I have a really bad comb over.
Hey, everybody. Good evening. Welcome to Mama Tribe After Dark. I'm MJ, and I've got Miss OG Mamacita in the flesh here to help me tonight for another episode of All Things Crunchy. We are talking about breastfeeding and probiotics tonight. And all things crunchy, we're doing podcast style Google Hangouts, and hopefully you can watch us live on YouTube or on Google or anytime after on either one of those social medias. We have the pleasure again of Dr. Philip Goscienski. We like to call him Dr. G. We are just trying to soak up as much information as we can from you, Dr. G. So thank you for joining us. And I say again because you have been on Mama Talks with OG Mamacita talking about vaccines, and you're going to do a
follow-up,
coming up next week on the 12th. And then you've also been on Live with Mama Tribe recently to talk about just what you do now that you're a retired pediatrician after many decades. So thank you for joining us tonight. We love. Oh, thank you. Yeah, we love to have you
to pick your brain.
Exactly. Thank you for letting us pick your brain. It's our pleasure to have you in our company, and I know we have a ton to talk about tonight, and this is a topic that is definitely very near and dear to my heart with the breastfeeding struggles that I've had, and I know that a lot of the mamas out there, I mean, I don't know a mama who hasn't had a breastfeeding struggle. It's amazing when you are able to breastfeed because it's a very hard thing to do. But tonight our topic is probiotics and breastfeeding. Like I said, I know we have a lot to cover, so I don't want to waste any time chit-chatting. I want to try and get as much information out there from you, Dr. G, to our viewers. So unless you want to introduce anything or talk about anything before we get to the PowerPoint presentation.
No, I think we can just go ahead and get started. And
okay.
The next slide pretty much is an accurate statement of what breast milk is like. And as a matter of fact, if anything, it understates the value of breast milk. And we used to think that it was only a nutritional factor, but in fact there is a great deal more to breast milk than we ever imagined just a decade or two ago.
Okay.
Now, if we look at the unique features of breast milk, what we see is,
well, there we go.
That number one is species, and what that means is that every single species, mammalian species, has breast milk that differs from every other. And the idea that they can be interchanged is simply false, and I think that will be pretty obvious by the time we have gone through this presentation.
Okay.
For another thing, it's not only species specific, but it's specific to the particular mother-infant dyad that we're talking about. And what I mean, as an example, is the breast milk that a mother made last year for last year's baby is different from the breast milk she's making for this year's baby because the babies are different.
Wow.
And that interaction actually modifies the composition of breast milk. One of the things that we are recently discovering is that even the gender production is different, so that the milk produced by a mom who has a male baby is different than if she had had a female baby.
Oh,
Same
wow.
mother, different babies, different genders, different chemical composition, which is really mind-blowing when you realize how far that is, even from the species-specific concept that we talked about.
And if I can just ask real quick, with as far as the difference in gender, I mean, are we? You may go into this, but what are we?
the differences?
Yeah, what are we finding out that's different?
And
I will
really
be
quickly. Oh, sorry. Really
farther
quickly.
and I'll give you
Okay.
some specific.
Oh, okay.
So can I ask a question too?
Yes.
I'm just wondering if what happens in a scenario where a woman is tandem nursing and she may have two children, one of either gender, is the milk then kind of made in a more generic form?
We don't know, because this particular phenomenon has only recently been discovered, and most of the studies, as I'll point out later on, have been done in non-humans, in primates, and we have not yet identified what the differences are between a baby, a boy baby, a girl baby, or one of each.
Okay.
And I have wondered about that ever since I came across that paper. So every couple of weeks, I go back to the internet, back to PubMed, looking for some new publications on this. Haven't found anything yet. So I keep looking. And maybe when we talk about this subject, I'll have something for you. But as an example, I'm sorry, I had a question?
No, I just said that's awesome. I mean, you're still looking for the answer, and we still have the questions.
I can't wait to see what the answer is going to be.
Yeah.
Another phenomenon of breast milk is that there's almost an unlimited supply, so that a mother of twins or even triplets can, without any real difficulty, if she is good at breastfeeding, handle the nutritional needs for every one of those babies. And there are lots of examples of triplets, for instance, who are solely breastfed without any need for supplementation. That's a phenomenal ability to crank up the volume for whatever is necessary.
Yeah.
Another aspect of this is that if a mother has a preterm delivery, the breast milk also changes, and I'll go into that a little later.
Okay.
Now, when it comes to features that are only in breast milk, and as you'll see in just the next few minutes, these are the kinds of things that simply will never be available in formula. One of those examples is endorphins. You're familiar with the runner's high. We'll talk about that a little bit, but endorphins are present in breast milk. They're certainly not present in formula. Mm-hmm. Another example is these items, lysozyme, we'll talk about that, secretory IgA, which varies depending on the environmental exposure of the mother. The same is true of protective oligosaccharides, mm-hmm. and antioxidants. Now, we tend to think of antioxidants as being present in our foods, but we now know that antioxidants are present in breast milk as well to counteract the chemicals, the free radicals that are formed under a variety of circumstances that protect the baby as well.
So awesome.
If we look at something like protective substances, one of those is lactoferrin. This is a viral agent. It has a number of functions, but antiviral activity is one of them. I mention that because we'll be talking about antibody formation and cells that are transferred to the baby for immune purposes. Lactoferrin is a very primitive chemical and is part of the innate immune system, of which there are many, many components. And long before mammals were able to develop antibodies and cells specific to fight infection, we had things like lactoferrin. Another example is the presence of cytokines. Cytokines are chemicals that are produced under the stress of infection, for instance, and they stimulate the immune system to produce certain kinds of cells. And these are present in breast milk as well, cannot be present in formula. Another is protective bacteria, and this is probably the epitome of what will probably never be in formula, and that is the bacteria that are transferred from the mother to the infant that play an extremely important role in the future of that child, especially where the immune system is concerned.
Right.
Well, we talk about endorphins, for instance. If we go to the next slide, endorphins are produced by the body as response to stress. The term endorphin comes from these two words, endogenous morphine. Mm-hmm. And it acts as a morphine because it's an agent that reduces stress. And as an example, a woman who has undergone vaginal delivery has more endorphins in her breast milk than a woman who has gone through a C-section. Now, one of the reasons for that is that in a vaginal delivery, the baby is going through a lot of stress as well. So if the mother produces endorphins, it helps the baby even out the stress response after a vaginal delivery. And so that may be one reason why breastfed babies, in fact, are somewhat more tranquil than babies that are born that are not receiving breast milk.
Free ride.
Yeah.
Sorry.
And of course, we all appreciate how important the infant-mother bond is, and more than likely, these endogenous morphine chemicals or endorphins play a role in that as well. If we move over to the immune system, what we find is that the baby does get some protection from infection from the antibodies that are transmitted across the placenta. However, that doesn't protect the baby against everything because he or she needs an extra boost, and that comes from breast milk. And one of the components of breast milk is something called lysozyme. Lysozyme, again, is a very primitive chemical. It's found in virtually, and lysozyme forms and other body fluids, and what it does is it actually dissolves bacteria. And interestingly, lysozyme was discovered by Dr. Alexander Fleming, who also discovered penicillin. And his discovery of lysozyme actually facilitated his discovery of penicillin. Another component of breast milk is oligosaccharides, and these are chemicals that actually block harmful bacteria from attaching to the wall of the intestine and to the upper respiratory tract, specifically the mouth and throat of the infant, to protect it from infection. And obviously, the oral cavity and the throat and the intestine are the portals through which some harmful bacteria can attack the infant, and this helps to protect the child from that. There's also what's called secretory IgA. This is one of the several classes of antibody. And the kind of antibody in this form of IgA that's formed by the mother depends on the kind of experience that she has had with various germs. And what that means in terms of the Stone Age, when a mother during the Stone Age was exposed to germs in her environment, she formed antibodies to those germs that were specific to that environment. And so the baby born into that community was protected from the germs that were present throughout that community as well. Mm-hmm. Now, another factor is interferon. And interferon has been known for 60 or 70 years. And it is a class of chemicals. It's a protein, and it's produced in response to either a viral infection or a bacterial infection, or sometimes cancer cells. And if we look at the experience in breastfeeding, we find that if a mother has influenza, for example, she produces interferon that pass into the breast milk and to the infant. And that interferon within the infant produces protection against infectious agent. Again, a very primitive type of protection, not as sophisticated as our antibody system, but is one of those systems that was developed eons ago in order to protect the newborn. Oh. Another example of interferon, I'd be happy to bring that up. However, even though this has been known for decades, there just aren't many studies of the effect of interferon in breast milk because we haven't realized until very recently of the presence of interferon, and especially the relationship of interferon production in breast milk when a mother has a specific infection.
So it's almost like a form of inoculation. If you're passing, in a sense.
Infection. Right. Now, something that really excites me about the whole concept of breastfeeding is the fact that there are live cells in breast milk. And at the moment, these are the kinds of cells that we are aware of. It wouldn't surprise me if in the next decade or so we found that there were other kinds of cells as well. We know, for instance, that macrophages are part of the system that we use to fight infection. They literally swallow up bacteria and process them so that we can form antibodies to them. Neutrophils are the kinds of cells that we see in, for instance, ordinary pus. Neutrophils gather as soon as there is any stimulation with a foreign material, whether it's a wooden splinter or a rose thorn or some sort of bacterium. Lymphocytes are cells that produce antibody and actually can be transformed into other kinds of cells that are part of the immune system. Then we come to stem cells. Stem cells are really exciting because we haven't been studying stem cells for very long. But what we do know is that they do contribute to immunity as well. We're beginning to find out that stem cells do things like protecting a child against future cancers in that child. I'll give some examples of that a little later.
Amazing.
Okay.
If we look at the live cells in breast milk, this is not anything new. We have known about these for over 150 years. And what we did not know was how there are different types, even though it was known more than 100 years ago that the cells in breast milk could kill bacteria and kill fungi. But that was a very primitive kind of knowledge that we have. We know much more about cells in breast milk now. What's really fascinating about this, and you have to think about this a little bit, is that the cells that we see in breast milk don't just spill over from the mother's blood cells. These cells actually come from the immune tissue of the mother, like lymph nodes and spleen and liver, for instance. They don't just come from the blood. And what's even more fascinating is that the infant doesn't digest these cells. Ordinarily, any kind of cell that comes from another organism will be digested, but infants don't digest these cells. Instead, those cells go through the intestinal tract. They go through the lining of the intestine, and actually they migrate to the immune tissues of the infant, where they can continue to influence antibody production, for instance, and the response that the infant can make.
I'm just completely blown away.
Mind blown over here. Mind
all over the floor.
Blown.
All over the floor.
Yeah, that's awesome.
Here's something that's also fascinating, that we know that those cells can persist for years. So we're talking 6 or 7 years. It's possible, although we haven't shown it yet, that they can last even longer. And the reason I say that, for instance, is we know that if, for instance, a 20-year-old child develops kidney disease and has kidney failure, needs a kidney transplant, if that child was breastfed by his mother, the kidney from that mother can be donated to that child, and the take will be better than just a random kidney or from any other member of the family.
Wow.
That's amazing.
That's incredible. And we have just barely scratched the surface of the importance of cells in breast milk. But if there's any argument that one can make to try really hard to breastfeed, this has got to be it.
Yeah, definitely. I mean, gosh, that didn't even factor in at all. I mean, that is life-saving if you need a kidney.
Exactly.
Yeah.
When we look at other things in breast milk, like fats, for instance, what we find that one of the major fats in breast milk is omega-3 fats. And omega-3 is what we find, for instance, in fish. And they probably influence evolutionary changes in the human brain. The reason I say that is because we know that about the time that humans began to eat seafood, especially when they were able to develop the tools that allowed them to fish a little over 100,000 years ago, that's when there was a huge increase in cultural progress. And anthropologists call that the lacustrine leap, from the word for lake, the Latin word lacus, which means lake. And so seafood diets increase the complexity of the human brain, and that is largely because of omega-3 fats. And most of the fats in our brain are, in fact, omega-3 fats in the brain and the eye, the eye, of course, is an extension of the brain.
Right.
If we look at some of the other factors that we know about now with omega-3s, there have been multiple studies that breastfed infants show more advanced brain and eye development because the concentration of omega-3s is very high in the brain and the eye. For instance, formula makers are beginning to catch on to this, and there are some baby formulas that now contain omega-3 fats. I really can't say much about that because I don't know what details are of omega-3. Especially if they are exposed to air. Excuse me. And so it's questionable whether simply by the air or simply by. So we look at we have to consider what happens to a premature baby. And the reason I bring this up is because the transfer of omega-3 fats from the mother to the baby occurs through the placenta, and almost all of it occurs during the last 2 months of gestation.
Wow.
Then you have to ask yourself, what about the poor kid who was born 8 weeks early and misses out on that entire supply of omega-3 fats? Well, it's nice to know that that mother who delivers a baby 2 months earlier has breast milk that has more omega-3s than if she had carried that baby to term.
Amazing.
So
Again,
awesome.
another astounding difference between breast milk and any breast milk substitutes.
Yeah.
And we know, for instance, that we can protect preemies from a specific disease. One of those is called NEC, or necrotizing enterocolitis. This is a condition which is relatively common among very low birth weight babies, and the smaller the baby, the more they have a risk of getting this disease, in which the intestine literally becomes destroyed. Sometimes almost all of the small intestine has to be removed, and the fatality rate can be very high. We're talking about possibly 25 to 40% in premature infants. And so what we have found is that if we give these babies breast milk, we can often, not always, but we can often avoid this child getting this enterocolitis. And so what happens if a baby that is too small to nurse, that baby can receive breast milk by way of a feeding tube and still get the protection against necrotizing enterocolitis.
Awesome.
If we look at another aspect of breast milk, again, this is often not appreciated, is that every breastfeeding day is different. For instance, when the mom and dad bring the baby home, and mom sends the dad out for a few cans of formula, and a week later goes out to buy more formula, it's exactly the same as the day the baby came home. 3 months later, if he brings home formula, it's just like the formula he brought in the first week. But every day is different when it comes to breast milk. For instance, in the first several days, the breast forms something called colostrum. And this is especially high in protective antibodies. It's so high, as a matter of fact, that it has a very dark color. It's not as light. It doesn't have that bluish color that mature breast milk does because of the antibodies that are passed through to the baby. Now, you may have seen colostrum advertised on the internet, but it's always what's called bovine colostrum, comes from cows. Cows don't get the same diseases that humans do. And therefore, the kinds of colostrum that cows produce doesn't have the value of human colostrum. And so colostrum from cows is no substitute from human colostrum. If we look at the milk that's formed later on, transitional milk, for instance, is higher in calories than colostrum, doesn't have as much protein because it doesn't need to, because the baby has already gotten a big dose of protein and antibodies in the first week or 10 days. And one of the reasons why transitional milk is so high in calories is because that's the metabolic demands of the baby is so high. For instance, if a baby weighs 7 pounds at birth, it will probably weigh about 14 to 15 pounds at 3 months. The next 7 pounds won't be added until the baby is a year old. So the baby gains as many pounds in the first 3 months as he or she will in the next 9 months. This is why transitional milk is so high in calories, because the demand is so high.
Is that why you see like super chunky babies when they're like really young, and then they
like the Michelin Man, right?
Yeah, and they thin out over time, and you just can't even believe that this thin little bean, beanstalk of a child was so chunky. Yeah.
It's interesting. If you've ever seen a childhood growth chart, which is on every pediatric chart, the growth charts that we used when I was in practice had to be modified, because when I was in practice, breastfeeding was not the norm. Babies were fed infant formula, which made them gain faster than breastfed babies. And I often had breastfeeding moms complain because they said, my sister's baby was born a couple weeks after mine, and he already weighs more than mine does. Is there something wrong with my breast milk? And I would have to tell them that the rate of gain of a breastfed baby is normal. The rate of gain of a formula-fed baby is not normal. It's too high, and it's one of the reasons that we are encountering the epidemic of obesity that we have now. Now, mature milk has about 50% fat calories. One of the reasons for that is that fat is very satiating, so that babies can go longer between feeding because they're getting fat, which allows them to go for more hours between feeding. And we know that in mature milk, where most of the studies are done, there are more than 1,000 different nutrients in breast milk. Now, there may be 1,000 different nutrients in cow's milk too, but they are not tailored for humans as breast milk is.
So now mature milk would be like what, from what time frame, Dr. G? From like 3 months to...
Right. There's no fixed time, but it's approximately 3 months and on. And you have to remember that the breast milk that's formed at 6 months is different from the breast milk that's formed at 12 months, which is different from the breast milk that's formed at 18 months. So almost every day, breast milk is changing.
Okay. And so then there's still nutrients in us breastfeeding our 3-year-old plus children.
That's exactly right. And the kinds of nutrients they're getting at 3 is tailored for a 3-year-old because the breast knows.
Yes. Yes. Yay.
Just like the breast knows whether you have a boy or a girl. And these studies have so far only been done in bovines and primates. But what we have found is that there are differences between the genders in those animals, And mothers who have girl babies have breast milk with higher calcium levels, whereas the mothers who have boy babies have higher amounts of fat. And again, to your question of what happens if they have twins, one of each, and I have grand twins, a boy and a girl.
Yeah.
We just don't know because, as I point out on this slide, there are yet no published studies in humans. But tune in because one of these days we're going to find out what those differences are.
Yes.
Well, something that is I've already mentioned is that the nutrient composition of cow's milk formula never changes, but baby needs to. And this is something that every breastfeeding mother should feel really good about, because what she is giving her baby is exactly what that baby needs at every life stage until they're 3 or 4 years old. Now, some of the things that we're finding out about bacteria, and this is what one of the focuses of this talk is that the cells of the human body number about 10 trillion. But the number of bacteria that we have in and on our bodies is about 100 trillion. In other words, about 10 to 1. Okay. And they vary a great deal. We used to think that there were probably only about 100 to 150 different species of bacteria that were felt to be very important in ordinary development. What we now know is that there are about 1,000 species of bacteria, and any given individual probably is carrying around about 300 or 400 different species of bacteria on any given day. And one of the reasons that that number has been boosted is because until just about 20 years ago, we were using isolation methods for bacteria present from stool, for instance, that were the same ones that were used over 100 years ago. Now we're using genetic tools to identify bacteria, and that field has simply exploded. So we're finding now that there are literally dozens more types of bacteria than we ever thought that we had, that we were carrying around on us. Now, these not only are essential, but not only beneficial, rather, but they are essential. No one can survive without these bacteria. Germ-free animals, for instance, don't live very long because they don't have the defenses that they need to survive. Mm-hmm. And we now know that the gut flora, these beneficial germs, are different in formula-fed infants than they are in breastfed infants. And we used to think that those good bugs came from a couple of different processes associated with birth. One is as the baby came through the birth canal, that the baby picked up the kinds of bacteria that the mother carried normally in her vagina, which are beneficial and protect the vagina. And as you probably know, it's not unusual when a mother is delivering to have some loss of bowel contents, and that sounds pretty gross, but it happens to be natural. Not only natural, it's beneficial because the baby who swallows some of the yucky bacteria is, in fact, improving his or her immune status by doing that. And then when we put the baby to the breast, which is now a practice in almost all hospitals around the country, within minutes of delivery, the baby also begins to swallow the germs that are present around the breast tissue. And that was thought to be, these were thought to be the main sources of microorganisms. But now we know that there is another source. And that is, even before labor begins, some of those beneficial bacteria in the mother's intestine are carried to the breast by way of specialized cells. Some of those cells may come from certain stem cells. And so even before the baby starts the delivery process, the breast is ready to colonize that baby with beneficial bacteria.
Wow, that is like just so awesome. I mean, I just
have this image of the magic school bus, in the body, and these little like aliens taking off. Oh, my job is to take good bacteria. It's just it blows my mind
Yeah,
how this stuff works.
Or just I think of all the moms who just doubt their bodies, and it's like, you know,
Exactly right.
we were definitely engineered.
Yeah, and I mean, not to say that there isn't, you know, certain factors for each different person, but you know, if the support is there and you go to your pediatrician and they're steering you the other way, then it's so easy for us to doubt. So.
Yeah, and as an aside, I want to point out that all these things are not taught in medical school, nor are they taught during pediatric residency training. This is a kind of thing that pediatricians have to pick up on their own, and if they're not interested in breastfeeding, they are never going to learn these things.
That's just a shame.
And what we know now, for instance, is that not only is breast milk not sterile, but those bacteria are essential for normal maturation of the immune system.
Yeah.
That this is one of the reasons why breastfed babies have fewer problems with a variety of infections than formula-fed babies.
Awesome.
Now, one of the things that is kind of interesting is that breast milk not only provides the bacteria that the infants need, but breast milk contains the nutrients that feed those bacteria. In other words, there are nutrient chemicals that the baby doesn't use, but the baby's bacteria use.
Okay,
so we send troops in with supplies, basically, right?
That's
we send troops in with supplies. We send them in with a sandwich.
So not only are not only are we like the mother set up to do what needs to do, but our babies are set up to handle whatever is getting thrown at them. I mean, it's like, that's just mind-blowing. That's awesome.
Every doubt I ever had in comprehending how humanity has survived the millennia, I now get it. You know, I now understand, because our bodies are just amazing. We really go on.
I mean, I will have to re-listen to this to just get the magnitude of this information.
Yeah.
So.
Well, I think that you can already see why I am so excited about breastfeeding and why I'm so passionate about promoting breastfeeding. And there's more coming in this presentation, so
yeah. Okay, hold on, everybody.
Okay. What we know, for instance, that there are certain benefits for the infant. Some of these are well known, some of these are not so well known. One of the things is that there is a lower risk of sudden infant death syndrome, or SIDS, in babies who are breastfed. And we don't know why, but there may be certain chemicals that change the way the brain responds, or the natural reflexes responds, because of certain factors in breast milk. Something akin to endorphins, for instance.
Yeah.
We've known for generations that kids who are breastfed are less likely to get otitis media, or ear infection. One of the reasons for that is they are less likely to get upper respiratory infection, which sometimes triggers an ear infection. We know that there is a lower risk of infectious diarrhea. This is really critical. As an example, a century ago, at the beginning of the 20th century, the leading cause of death, the #1 cause of death in children, was diarrhea. Because at that time, we didn't have the tools that we have for hydrating babies, and we didn't know as much about baby chemistry as we did about grown-ups chemistry, and sometimes we simply gave them the wrong kinds of materials. This is extremely important in third world countries, which are now where we were a century ago. And what we know now is that breastfeeding is literally life-saving for hundreds of thousands of babies in third world countries from one single problem, and that's infectious diarrhea.
Yeah, wow.
Now, I don't know if you're familiar with pyloric stenosis. This is a condition that occurs in the first few weeks of life. It tends to occur more often in boys than girls for reasons I don't know. More often in the firstborn boy. Again, we're not sure what the reason it is. But what happens is the outlet of the stomach is ringed by a muscle that periodically relaxes so that the stomach contents, when they've been churned up adequately, then pass on to the small intestine. Some babies get what's called hypertrophy or overgrowth of that ring-like muscle called the pyloric sphincter. And if that is not treated, which is almost always surgical treatment, although there are some exceptions, but it's almost always with surgery, their babies will then vomit whatever they're fed, become dehydrated, and babies used to die regularly when we didn't know what this problem is. It's relatively easy to diagnose for an experienced pediatrician, but what we find is breastfed babies don't get pyloric stenosis as often as formula-fed babies. Another benefit that we didn't realize until relatively recently. I mentioned earlier that the weight tables and the weight charts of babies are different between formula-fed and breastfed babies. So much so that about 15 years ago, the World Health Organization came to the realization that the growth charts that we had been publishing for decades were simply wrong. That we were telling mothers of breastfed babies that their baby's weight gain was not normal because it was below the curve, below the 50 percentile, when in fact, breastfed babies' weight gain is the norm. And so as a result, the World Health Organization has revised the growth charts for infants to reflect what is normal or breastfeeding weight gain.
That's awesome, because that is like one of the biggest problems that moms usually have is they're, you know, in the beginning, that's all you can really do is check the weight, and then that tells you if you're, you know, if your baby is
thriving.
Doing well, is thriving, exactly.
That's right.
So, awesome.
Now, some other benefits are long-term benefits, because breastfed babies are less likely to develop certain conditions, one of which is type 1 diabetes, possibly because we have found that cow's milk is one of the factors that increases the risk of type 1 diabetes.
Wow.
Is the incidence of type 2 diabetes as well. And that's a completely different mechanism, but one of the factors, not the only factor, but one of the factors may be because breastfed babies don't gain weight as fast as formula-fed babies, and in a moment I'll explain why. And so they are less likely to become obese as they get older. And as you know, overweight children become overweight teenagers who become overweight adults. This is exactly that very few people can avoid.
Yeah. Yeah.
I'm not referring to anyone in the audience.
Well, OG's referring to herself over here.
Another is that a breastfed baby is less likely to develop osteoporosis when she is in her 60s.
Awesome.
Yeah.
And we're still not quite clear as to what the mechanism is.
Well, it's that extra calcium in the milk.
Yeah,
well,
right?
It's that extra calcium.
And you may have something there. It may be that that initial burst of calcium is handled differently than the calcium that the baby will receive later on in life.
Yeah.
It can somehow set the stage for more normal bone growth.
That's what I just keep thinking, like even with the gut flora, you know, it's like we're creating like a blueprint, and you know, as long as you have that stable foundation.
Oh, the infrastructure.
Yeah.
Gotcha.
Yeah, like, you know, when we're screwing with it in the beginning, we're setting the you know, the snowball effect of problems. Yeah.
Creating the pathways and
Yeah.
Exactly correct. Yeah. Also, a breastfed baby is less likely to develop asthma as he or she gets older. Part of that has to do with the immune system as well. Don't really know what the mechanism is yet, but it may be because of certain factors in breast milk that somehow program the immune system so that later on when that child is exposed to environmental chemicals or certain viruses, for instance, he or she will not respond the same way as a formula-fed infant and therefore will avoid asthma. And another one is eczema. Same thing. Eczema is an immune problem, and we find that breastfed babies are less likely to develop eczema. Okay. And although eczema tends to be inherited, just like allergies in general tend to be inherited, we know that breastfeeding is one of the protective. And this is something that is truly astounding. This may really give mothers-to-be, incentive to breastfeed their babies, because we have known for about 20 or 25 years now that a baby that is breastfed has a lower risk of getting leukemia or lymphoma. That's not an insignificant risk. It is approximately 20 to 30%. That's a big deal. Yeah. Again, we don't know what the mechanism is. The current theory is that those stem cells that I mentioned, that I said we really don't know what their purpose is, what their purpose may be to program the baby's body so that when abnormal cells begin to form, those stem cells gobble them up and keep them from progressing to leukemia or lymphoma. Again, this is well established. The meta-analysis just came out a couple of weeks ago, and it's certainly an incontrovertible fact now that this is one of those diseases that is less likely to occur later on in a breastfed baby.
Yeah, that's amazing.
Yeah, that's awesome.
That is just, yeah. I need more superlatives. I'm running out of words over here.
Okay, now here's one that's a little sticky. We're not sure about this one. And that is, does breastfeeding prevent obesity later in life? And the information that we're getting now is a little confusing, but keep in mind that we're looking at a moving target. Two things are very different between this generation and, for instance, the generation in which my kids were born or you were born, in that when you were kids, your mothers weren't breastfeeding. Most mothers were giving formula at that time. Things have changed now. Breastfeeding is becoming more common. However, there are other factors that are important. But let me go back just a little bit and make a comment about what breastfed infants benefit from. Because of the nature of breast milk, breastfed infants don't put out as much insulin as formula-fed infants. The reason that matters is that high insulin levels stimulate the multiplication of adipocytes, which are otherwise known as fat cells. So higher insulin levels create more fat cells, which later in life can store and accumulate fat. So the fewer fat cells you have by the time you're 2 years old, the less likely you are to become obese when you're 12 years old, because you don't have as many cells to pack with fat.
Right, and that is what I know as a woman, you know, because people always talk about, oh, I'll just get liposuction. But when you take out those cells, when you do the liposuction, they will just grow because your body is conditioned to have
that number of cells.
Exactly. Is that right?
Well, I'm not enough of an expert on obesity to be able to comment on that, but liposuction is a very temporary fix.
Yeah.
There are now other factors in our diet, in our lifestyle, that overwhelm the beneficial effects of breastfeeding when it comes to preventing obesity. One of the talks that I give is how the computer affects your health and your brain. And I point out in that presentation that the average child spends 8.5 hours a day in front of a screen. So instead of being physically active by playing outside, those kids are now inside, and the only muscles that they're exercising are the muscles in their thumbs, which has another downside because repetitive stress injury of the thumb has become the bread and butter of orthopedic surgeons because it's so common.
What?
So, again, one of the things about obesity is that there are many, many factors, And one of those, as a matter of fact, is probiotics. We can talk about that sometime. But there are so many other factors that breastfeeding has been losing its punch, so to speak.
Wow.
Now, there's also the factor to consider of maternal benefits of breastfeeding. And one of the things that we have known for hundreds of years, I guess, is that when a baby goes to the breast immediately after delivery, the suckling at the breast causes the uterus to contract. That's a big deal because it limits bleeding.
Mm-hmm.
And you can imagine that in the Stone Age, when there was no way to control bleeding, that was an important factor in preserving the life of the mother.
Mm-hmm. And they probably didn't even know they were doing it.
Yeah. Right. Now, another benefit is that there was a lower incidence in the mother of, for instance, premenopausal breast cancer.
Yeah.
In mothers who breastfeed. We find that they have less ovarian cancer. One of the reasons for that is that mothers who breastfeed can go 2, 3, or 4 years without having menses. Mm-hmm. Therefore, they're not popping out an egg every month. Every time an egg pops out of the ovary, it causes some local inflammation. And one of the theories of ovarian cancer formation is that that monthly, what's called incessant ovulation, stimulates cells in the ovary to become cancerous. And so women who breastfeed, especially those who have several children, are less likely to have ovarian cancer, which, as you know, is a devastating cancer because it's so hard to identify. Yeah. Women who breastfeed also have less metabolic syndrome. They have less coronary artery disease. They have less calcification within the aortas. Mm-hmm. Again, we can't explain all those mechanisms, but we know that from observational studies, these things are true.
Yeah.
They have less type 2 diabetes. And possibly because one of the known effects of breastfeeding is that mothers regain their pre-pregnancy weight faster than mothers who don't breastfeed. Therefore, that lowers obesity, lowers the risk of type 2 diabetes, and lowers the risk of rheumatoid arthritis. I don't have a clue as to why there's a difference in rheumatoid arthritis. But again, this is something that's been observed in breastfeeding mothers compared to those who don't feed. And another is postpartum depression.
Yeah.
Again, we don't really know what the mechanism is, but we do know that postpartum depression is less likely. It may be because the hormone oxytocin, which is released with nursing, protects the brain from depression.
Yeah, definitely. I mean, I can tell you that for a fact that, you know, breastfeeding my baby was a way to lift my spirits after.
Yeah. You get kind of euphoric sometimes, you know, particularly early on. Like I used to get, I called it milk high, and then I would pass out.
Uh-huh.
Oh yeah. Whenever I had to pump, trying to get my milk supply up, I would always want to fall asleep when I was nursing or pumping. Yeah, definitely.
Now here's something that I just alluded to, and that is that the mother who breastfeeds gets back to her. Let's back up 1 minute, one slide. That the mother who breastfeeds will regain her normal weight faster than non-breastfeeding mothers. Yeah. Now, this makes a difference because we're looking at the rate of obesity, which is especially a problem in older women, especially in minority groups, where obesity increases the risk of a number of diseases, especially type 2 diabetes, which is an epidemic, literally, in this country, where we are now at 9% of the general population has type 2 diabetes, and in patients over 60, it is 30%. And by the middle, it will be 50% in that group.
And so I'm sorry, but
there.
Is it type 1 that is something that is, which one is preventable? I mean, they're
controllable by diet.
Yeah, like, I mean,
Type 2 is 100% preventable.
Yeah.
Again, 100%, just to make sure nobody misunderstands me. But people who have normal weight almost never get type 2 diabetes. Now, there are some exceptions.
Right.
One of the exceptions is what we call normal weight obese. People who appear to be a normal weight based on the standard height weight table, but their body fat percentage is higher than it should be.
Okay.
That's enough if they have a genetic predisposition to type 2 diabetes to push them over the edge.
Right. Yeah.
Now, there about 5% of people with type 2 diabetes have other causes of diabetes, but by far, type 2 diabetes is preventable disease. Type 1,
I'm sorry, go ahead.
Type 1 diabetes is the kind that tends to occur at younger ages, sometimes immediately after birth. I mean, it's a terrible disease. And that is not, it's somewhat preventable, and I won't go into it here because it's kind of complicated, but it's one of those diseases where the insulin-producing cells of the pancreas are literally destroyed, and those children need insulin as soon as they're diagnosed with diabetes, whereas someone with type 2 diabetes may go for years and years and never need insulin.
Yeah.
Because their body doesn't respond to insulin, and they're pumping out a lot of it.
Gotcha. I'm guessing that the type 2 diabetes was on the incline once our country, at least America, had just the need for convenience, and our food started to get more processed, and we started sitting down more and not being more active.
Well, one chapter in my book has to do with diabetes. And I point out all the factors that go into type 2 diabetes and how relatively easy it is to prevent it. It is one phrase. It is not rocket science to prevent type 2 diabetes. Now, this is another interesting phenomenon. Again, it was found out only recently. It has to do with mastitis. Now, do you happen to know anyone who developed mastitis while they were breastfeeding?
I know plenty of mamas. Yeah. We've got one in the flesh right here. I did. I actually didn't ever have a problem with it, so.
Okay, that was a real pain, pardon the pun. But Erin, thank you, lucky stars, because here's what's been found just over the last few years.
There we go.
That even though mastitis occurs in 10 to 20% of breastfeeding women, what we find from a study that was done in New England was that women who had mastitis had a lower risk of ovarian cancer by more than 30%.
Wow. Yay! Awesome.
So to all the mothers out there who had to suffer through mastitis, you might consider saying thank you to your baby for being responsible for causing life.
So then I wonder.
There's no doubt about that, but a little bit of pain, well, or even a lot of pain, is worth saving someone's life from a disease like that.
Absolutely.
I wonder how much it increases, or if it does increase with the amount of times that you get mastitis, because I know moms who have had it not
multiple
just once,
times.
not just twice, but have had it so many times that it's like, so.
That's such a good question, MJ. I have it right here on the slide.
Yay! Perfect.
Excuse me.
The more babies a woman has, and the more episodes of mastitis she has, the greater the protective effect against ovarian cancer.
That's
Yay!
That's
Thank
fabulous.
you for answering my question.
The good question.
Thank you.
Now, it may be an immune phenomenon, because what we find is that the woman's body produces something called anti-mucin antibodies, which have the effect of inhibiting ovarian cancer. And there may be a vaccine for ovarian cancer as a result of those studies. One of the reasons I'm hopeful about that is that if a woman has had mumps, she has a lower risk of getting ovarian cancer. And mumps also produces these anti-mucin antibodies. So it's interesting to project what will happen in the future because of this finding, which is relatively new.
Huh.
That's awesome.
I'm very curious now about that.
Okay. Well, I don't have a lot of answers because this is relatively new information.
Yeah.
And are beginning to just explode effect on ovarian cancer, which I think is probably the 4th or 5th most common disease among women.
Yeah.
Cancer.
Wow.
Breast maturity is something that is fairly recently elucidated, and that is the human breast, the mammalian breast, does not become fully mature until the woman has undergone pregnancy and lactation.
Wow.
And the downside of that is those immature breast cells, which remain immature even if a woman lives to the age of 90 or 100, are more susceptible to carcinogens, like the ones in tobacco smoke, than cells in the breast which have become mature because they have undergone lactation.
Crazy.
Now, if there is any reason for telling young women not to smoke, this is an important one. Because if they start smoking when they're 14 or 15 and they don't have their first baby until they're 25, they're looking at 10 years during which the cancer-causing chemicals in cigarette smoke can transform the cells in the breast to become cancerous.
Wow. My gosh, that is so odd. And then just thinking of like the women who don't want to have children.
Yeah.
And that are smokers too.
We do know that women who have never been pregnant do have an increased risk of breast cancer. And as an example, nuns have a higher rate of breast cancer than women in the general population. I had a cousin who died of breast cancer who had been a nun. And so this strikes a chord with me, because it's one of those things that in the future may be done to make those immature cells become mature even in the absence of pregnancy or lactation. I can see that on the horizon someday.
Oh yeah, definitely, because you just have so many women out there who, you know,
for a multitude of reasons, just never have, or may get pregnant but may not arrive to the lactation point.
Yeah.
So that would be phenomenal. That'd be great.
I hope somebody gets funding for that, because I think it can make an enormous difference for breast cancer.
Yeah.
Well, maybe the Pope can get behind it since he's got so many nuns as his minions. You know.
Yeah. Save the nuns! Save the nuns!
Save the nuns! Free the nipple and save the nuns.
Now, looking at people in the Stone Age, very few women in the Stone Age went through their lives, at least if they made it to the age of 25 or 30, without being pregnant at least once, and so that breast immaturity was rare. In addition, they didn't smoke.
Right.
And they were not exposed to household chemicals, to pesticides, to the kinds of chemicals that are emitted by automobiles, for instance. And so it's likely that very, very few women ever got breast cancer back in the Stone Age. Now, there's something that I want to talk about now that actually may offend some women, and that is what I call the grandmother effect. And the fact is that grandmothers, and that includes aunts, were able to help those Stone Age women deliver their babies, manage pregnancy, help them to breastfeed, etc. And that didn't change until about the middle of the last century. And so what we find now is that because breastfeeding declined so drastically in the early to mid 20th century, so did the expertise that grandmothers and aunts had about breastfeeding. And so if today's mother is having a challenge with breastfeeding, she's wasting her time talking to her mother or even her grandmother, because more than likely they don't have a clue as to how to handle that problem because they never experienced that. Most of today's grandmothers did not breastfeed, therefore they don't have that advice to pass on that grandmothers did in past generations.
Yeah, well, we're both shaking our heads here.
Yeah.
And today's lactation consultant is yesterday's grandmother. Yeah. And they have such a valuable role in protecting women from some of the hazards of breastfeeding and of not enabling them to breastfeed. One of the reasons I appreciate what lactation consultants do is that there are studies that show that if you look at mothers who are on the verge of giving up, if the mother and the father are counseled as to how to breastfeed properly, about 60% of those women can then go on to breastfeed successfully.
Yeah.
And I think that as we get better and better at how to teach mothers this, we're going to find even better results. So grandmothers may not be the greatest asset, but we have in virtually every city these days lactation consultants who can perform that role.
Yes, and more pediatricians should refer to a lactation consultant if they're not already hip to, you know, the benefits of breastfeeding. But that's one of the things that we find when we encounter moms who need that support is that they go to their pediatrician and their pediatrician is recommending other things besides breastfeeding, and then that's where they get thankfully from somebody else, go see a lactation consultant.
They'll get. We're huge proponents of the lactation consultant.
Yes.
Right. Well, some other things to consider is what we can expect in the future, and there's a lot that's on the horizon. You've already gotten an inkling of that from the things I've discussed. But even though we already know that there are about 1,000 different nutrients in breast milk, we're probably going to find out that there are even more that have a profound effect on the development and the good health of the infant. We're also going to find out why there are stem cells in breast milk, because so far that's not very well understood. As I mentioned when I discussed leukemia and lymphoma, it may be that that's one of the purposes of stem cells, and I can postulate a whole lot of other things as well. Transformation into cells that repair organs, like kidney or liver or lung, stem cells that can maybe attack cells that are beginning to become cancerous, besides the ones in the blood that cause leukemia or lymphoma. But I think that this is going to explode in the next decade or so. What we're going to find is more information on how breast milk changes with the gender of the infant, because we know that this is a fact with primates, and we are not so far removed from primates that it's likely to be an unimportant change.
Yeah.
And we're going to find out that, as I mentioned, the omega-3 load in breast milk is different in mothers who have preemies. I feel that we're going to find that there are other nutrients in the breast milk of a mother who delivered a preemie than just omega-3s. I can't believe that there's only one substance that changes just because a baby is born early.
Right.
Right.
I'm willing to bet that we're going to find literally dozens, if not scores, of other things that have an effect on the outcome of that preemie's life.
Yeah. So even more so reason why a mom who's had a baby prematurely in the hospital should try to pump, try to get the milk extracted, and you know, you almost have to sometimes fight.
Force your way. Yeah, you do.
Fight for your baby to get their own milk.
You do.
So, but that's another reason why, you know, just that. I mean, if you cannot somehow get your own milk to the baby, then hopefully maybe there can be a way for you to still get breast milk of some kind to your baby, if it's not from you.
But as we said, the infant-mother dyad is very unique. And so we can't really expect to get the same results with milk from other sources, especially milk that's been frozen. Because milk that's been frozen has no more live cells.
Right.
And those live cells have an effect.
Right.
Now we can expect is how having multiple babies milk composition. We already know that the volume can increase. I can't say without limit, but certainly very dramatically. I have one of my patients who had twins was breastfeeding, and her twins they looked like the Michelin Man. Just this enormous supply of really healthy breast milk, and those kids did great. They went way beyond the breast milk growth curve. And she just really enjoyed breastfeeding, and you could tell because of the way those babies grew.
So I'm going to make a little note here because I think you and I have talked about this a little bit, but we may have to do this another time about milk sharing, because that's how I fed my little boy, was through milk donors and mamas who shared their milk, but I always got it frozen. I never really got it fresh. we never wet nursed, although I wouldn't have been opposed to it, but so maybe I know you have a opinion about milk sharing and some things to talk about that, and then also too I'm going to make a note about the breast milk being frozen, and maybe what
other options might be available.
What other
consider.
Options, and then just I know that if the live cells aren't alive, maybe that you can help me understand that there still are some good things that were in that frozen breast milk.
Absolutely, there's no question about that. And I'd be happy to spend some time talking about that at another session.
Awesome.
But I want to finish up with this slide.
Yes.
And the bottom line is that there are no biological disadvantages to breastfeeding. I mean, simply none.
Yeah.
Even in mothers who have HIV, some of those mothers can breastfeed.
Mm-hmm.
And if we're looking at women in a third world country where water is not reliable, very likely to be contaminated, and her sources of other types of animal milk are very limited, there is more risk of not feeding her by breast than feeding her even though she might have HIV. And now that we have medications that will treat that disease, that's even more reason to continue to breastfeed. Again, that has got to be a very individualized, very specific decision by the physician and the mother, but even the bottom line is that there are no disadvantages to breastfeeding. Even mothers who have mastitis, even if it's caused by a bacterium, they can still breastfeed.
Right.
Yeah.
Right.
One other point.
And lots of mothers too, Dr. G, that are on certain medications, they get discouraged by medical professionals to continue to breastfeed, but we are always constantly trying to educate them on really, delving into exactly what the medication could do if passed through to the baby. And a lot of the medications out there don't harm your baby, and mothers can continue to breastfeed. So,
and sometimes timing that makes the difference between the dose of the medication and the time it starts to breastfeed. So that's an extremely complex problem because, as you point out, there are so many different kinds of medications. Sometimes it matters, and there are some medications that simply preclude the mother breastfeeding, but there are not nearly as many of those as people worry about. And the final point that I want to make is that there is a learning curve for the mother, but not the infant. The infant does not have to be taught how to nurse, but the mother has to be taught how to do it right. You would think that this is instinctive, but unfortunately it's not as instinctive as you would think. One of the reasons for that is that in times past, the mother would be given advice before she delivered the baby about what breastfeeding is all about. But the mothers don't get that information anymore. So when they put the baby to the breast, that's the first time they've thought about what breastfeeding is all about. So they don't know how to present the nipple to the baby. They don't know how to position themselves. All those things that lactation consultants can teach them.
Yeah, yeah, and the one of the things that I I didn't notice until actually Jason was 18 months old, was he had a lip tie, and I wonder if your in your many years of practicing, you know, did you see this increase? And I actually read something recently that it was the moms that are increasing their folic acid intake that are creating this issue with lip and tongue ties. I just read this article recently, but I myself heard about folic acid, and that how folic acid will help with, you know, brain development. And
I took a lot of folic acid in my pregnancy.
I did too. I took a lot prior to being pregnant, and I took a lot during my pregnancy.
So did I. Interesting.
So
well, that is a very complex issue. We could spend half an hour talking just about that.
We'll have to find another date.
The Breast Coalition has sponsored a symposium on frenulotomy, which is cutting that band of tissue. I don't know whether they've already had that symposium or whether it's coming up in the next couple of weeks. But if you go to San Diego Breastfeeding Coalition, it will probably have that posted on their website. And again, I apologize if they've already had it. But one of the pediatricians who was one of my residents at the Naval Hospital, Dr. James Murphy, has become kind of the local expert on that issue, and he's going to be discussing that. So the viewpoints of frenulotomy have changed very dramatically over the last couple of generations.
Yeah.
It's one of those things that you cannot make a general comment about the value of frenulotomy, but it's very controversial still, but we're learning a lot more about it than we knew just a few years ago. Yeah,
and it's really a personal decision, because like your slide says here, you know, there's a learning curve for the mother but not for the infant. So, you know, for somebody like me who I didn't really notice my son's lip tie until I just started getting more and more information about lip ties, and then I looked and I saw that he, you know, the skin that was connecting the lip to the gums was very tight, you know, and that I always had to flip his lip out, you know, every time that he would nurse, and I still actually do it just by, you know, yeah, definitely, I've done it for so long, but you know, like your slide says, it's a learning curve of the mom, because I learned how to nurse. You know, some moms have other symptoms like pain or just, you know, their baby not thriving, transfer, and all, you know, so there's other issues. I didn't have those, but it definitely was a learning curve for me to learn how to nurse him to overcome this.
Yeah, it's a very complex issue, and we can spend some time talking about that sometime.
Okay.
And finally, I will leave you with one more slide, and here's a message from
And this is the most true slide ever.
Love that expression.
You will never sleep in again. You know, that's one of the things that my husband and I, we always kind of daydream about. Like, do you remember when?
We would go and have brunch on the weekends and sleep in.
We would take a nap whenever we wanted to, and I love there's some comedians out these days who one of them says, "How did you leave the house before you had children?" Well, we said, "Would you like to leave the house?"
Let's leave the house.
Let's leave the house, and we left the house. And then, how do you leave the house now with your children? And it's get your shoes on, do this, do that. So, yeah.
Very true.
So much has changed, but yet we wouldn't change a thing, right? So, like, you know, our minds are blown, Dr. G. I love your delivery, and you know the way that you present the information. It's for somebody like me who is very street smart and not very book smart, it helps. And for somebody who I know is book smart and street smart, you know, she can understand. But I think that, you know, us just out there in the world and the people who are viewing this live or will watch it later, just thank you for presenting it in a way that we can understand it.
You're very welcome.
Thank you for showing us how complex breast milk is, really, and giving us just a kind of a glimpse at how complex our bodies as mothers and the makers of breast milk are, and how our children are born ready to receive. That's right. Pretty freaking awesome.
Yeah, I think that, you know, there's a lot of factors these days, a lot of outside information, a lot of medical professionals, unfortunately, that might have, you know, tried to introduce that our bodies aren't as amazing as they are, and that's unfortunate. But, you know, this presentation and, you know, as thankfully, a lot of the people that are encountering this information do reach out to other people to have their, you know.
What would happen if all women breastfed and we could cut back on all the problems that breastfeeding helps to solve, such as future osteoporosis and type 1 diabetes, type 2 diabetes, heart disease, cancers. I mean, what would that do to our economy to reduce each of those diseases by only 10 or 15%? Yeah. Well, and it's done by doing something that mothers have done for literally millions of years.
Well, I'm not sure there would be a lot of people out there that would be very happy with the economy if everybody breastfed, because our society would be a little more healthy, need less medicine or possibly medical attention. But yeah,
well, that's just crazy talk, Dr. G. That's just utopian crazy talk.
Well, we have to make those kinds of changes, or else we're headed for some real tough times in the healthcare system and being able to finance it.
Oh, absolutely. Yeah. You are preaching to the choir. MJ and I are certainly on your side in that, and do everything we can to spread the knowledge, certainly, that breastfeeding is vital. Now I understand more so than I ever had. And, you know, it's just every day we try and normalize it a little bit more. So thanks for your help and this great information.
Yes,
you're very
definitely.
Pleasure being with both of you.
I know, definitely. Well, we're going to wrap this up, but don't go, Dr. G, because we'll hang out in the green room for a moment after we end. But I did want to, you know, just promote your website that you have there in your lower third, stoneagedoc.com, because you have, I know your book is in its last edition. You were telling us, but there is still copies available if anybody's interested. And then also you've written a column for many years, and so you have, you know, 500 articles like we were talking about earlier. And just, you know, your contact information is on the website, and then there's so many different topics that you present about. Yes.
A plethora
of topics. And, you know, not just with us. We're trying to snatch you up as much as possible, but you know, you're out there traveling around and giving these presentations to a variety of people. So you know, that way, and I know that you've commented before on hangouts that we've had, that people can email you and ask you questions, and you're happy to.
That's awesome.
Yeah. Thank you.
Very cool.
I will travel any place in the county to give one of the 50 or so presentations that I have for a variety of audiences. Many of them are, of course, designed for older people, because that's where I've given most of my presentations. But I try very hard to get to parent-teacher groups, for instance, because that's the generation that has got to be informed about things like this, and about obesity, and about type 2 diabetes, because those two diseases are not part of our normal nature. And we can't do something about them.
And that this is why, you know, OG and I are just so passionate about doing these talks with you, doing these hangouts with you, getting as much FaceTime as we can with you and trying to pick your brain, because I think that our generation, you know, I'm 38, but I am, we're not going to talk about your age, but, you know, this is something that is very important to me, and I want to learn as much as I can. And I think that the younger generation, even though your topics kind of tend to be presented to, you know, older people, I think the younger generation is really interested in this, and so that's why we're trying to you know, get as much as we can covered with you, because you have this awesome information that we're looking for. So so thank you again. We appreciate it.
So the gushing fangirl moment is over now, Dr. G.
I'm all red. You can't tell because Google makes me look so good, but I love you. I really do. I mean, I think it's just breastfeeding.
I will help MJ cut this.
I know.
Have her say goodbye.
Yeah, and I just want, you know, there's plenty of things that we've talked about that we would like to talk about in future hangouts. But if you out there are watching and you want to reach us on Facebook or Google Plus and let us know, or even email Dr. G and say, you know, talk about this, then let us know, and we will end this hangout, All Things Crunchy. And thank you, OG Mamacita, for putting the PowerPoint up. Thank you, Dr. G, again. I know we've thanked you a million times, but thank you again. And we'll end this now and hang out there so we can chat. But otherwise, we'll see you guys out there in
the flat world.
Yes, thank you. We'll see you guys soon. All right, thank you. Bye.